Now.
Let's start.
Good morning, Dr. Manzi. I think we are having a connection problem. Just want to check whether it's my side or your side.
Mr. Minister, it is on Dr. Lwazi's side.
So I couldn't hear her. If you heard what she was saying, that would be fine. If not, we could start at this point. Yeah, so you find, can we proceed from our side?
Yes, Mr. Minister, you can proceed.
Okay, thank you very much. Let me start. Firstly, just to acknowledge all the members of our team, Deputy Minister, Director General, and the rest of the members of the team from both the public and private sector, and fellow South Africans. Today it's our great pleasure to launch the official South African COVID-19 vaccination program registration portal. The Electronic Vaccination Data System is now available to the general public and invites all the citizens who will be aged 60 years and above to register for vaccination. So those who will be turning 60, excuse me, those who are turning 60 from 2021 would then be eligible for registration. We are doing this because we have said to make it easy to implement the vaccination program, guided by our scientists and our Ministerial Advisory Committee. We must prioritize those who are 60 years and above. And then, of course, in the same course of phase 2, we will be focusing on the frontline workers, and the next batch would have to be around those who are 40 years and above. This is really just to ensure that infection, we can protect many people from getting severe disease, from hospitalization and death. So the prioritization is just to make it easy to vaccinate and to order people to come in batches that are manageable. So, but we have said that phase 2 is going to focus on those who are in vulnerable settings. And so we are prioritizing within that category. So we haven't changed a lot other than to say we'd like to see the 60 years and above being prioritized, and then of course 40 years and above prioritized, and then we move on. So we will be announcing it clearly as we move on, but it makes it easy to schedule the vaccination if we approach it from this point of view. This launch then marks a significant milestone, not only for our vaccination campaign, but for South Africa's advancement towards universal health coverage. It's the first time in our democratic history that a major public health campaign will be supported by one digital system for all South Africans. And this is in line with the 9th pillar of the Presidential Health Compact, which commits to strengthening the health systems by developing an information system that will guide health policies, strategies, and investment. Some of the key activities proposed in the Presidential Health Compact have found expression in the development and the establishment of the Electronic Vaccination Data System for the general population. And these include, by example, one, developing a system that complies with the interoperability standards for digital health. Most of the IT system in different provinces have been developed in different ways, but we've made sure that they're all interoperable so that you can actually connect to a common system that makes us all to be able to use the information available right across. Then second is capitalizing the functionality of a South African health information exchange service to allow the secure sharing of data between different systems that make up the Electronic Vaccination Data System. And next is the development and implementation of procedures and systems for identity verification of users of health systems, both those in public and private, and in expanding the capabilities of the health patient registration system platform. In the long term, we'll then have all of this information shared in what we call the health patient registration system, which will then mean that all South Africans are registered in that system. And then utilizing business intelligence platforms and data lake functionality to standardize health outcomes reporting for both the public and private sector. I'm highlighting this because it's important to demonstrate the critical foundation that was laid by the leadership of our president and subsequently the commitment of the department to follow through on these determinations and manifest advancements towards the implementation of the National Health Insurance. I must congratulate the development team, ably led by Ms. Melanie Volmarans, for their stamina and the sheer determination to ensure that this system is implemented on time and is user-friendly for our citizens, and they will be introducing themselves in a moment. The President, myself as the Minister of Health, hundreds of thousands of healthcare workers, and now you, the citizens of South Africa, have or will have all access the vaccines through the same process by enlisting and using this system. There will be no distinction between private and state healthcare users, with the exception that private healthcare users will input their medical aid details. The quality of the service will be the same for all of us, and the system will assign a vaccination site closest to our homes where we work, not based on whether a particular site is a public or private facility. This system is therefore a proud representation of the future of healthcare in this country under the National Health Insurance, which is typified by multi-sectoral collaboration and social solidarity. In this regard, we are joined by representatives from Business for South Africa, because the realization of this system would not have been possible without the collaboration of the public and the private sector, using the capabilities within business at large. This outcome shows that indeed our society is maturing in the right direction, a direction towards the health system strengthening as a unified force. In a short while, the team will do a demonstration to show us how easy it is to register on the EVDS system. If you are 60 years or older, excuse me, you may now register for vaccination. You must have your ID and medical aid card, if you have one, ready before you register. And when you register, it's very important that you put the correct cell phone number, the address where you live, and the correct medical aid number if you have one. Remember that registration does not guarantee that you will be vaccinated immediately. We will use the information you have provided when we register to communicate with you about the vaccination program when necessary. The data from the system assists us to allocate the vaccines to the vaccine service point and ensuring that enough vaccines are available on a particular vaccination day. The details of the vaccinations will be captured digitally, creating an electronic health record. In cases where we have your mobile number, you'll receive an SMS confirming that you have been vaccinated, and you'll also be provided with a vaccination card. So to register on the website, first make sure that you have internet access. You will need a smartphone or a tablet or a computer. Connect to the internet and go to the vaccine.enroll.health.gov.za. The welcome screen will guide you through the steps, and this is what the demonstration team will show you just now. It is important to follow the instructions and put in all the details the system is asking for. When you are finished, the system will send an SMS to the phone number that you have provided. The SMS will confirm that you are registered. This means that the system now has your details in a queue to be scheduled for vaccine. When it is your turn to be vaccinated, the system will send you another SMS with a date and a place where you will be vaccinated. If you put in the correct address, you will be sent to the vaccination center that is closest to your home. Some of you may be directed to your place of work. If you have problems, you may contact the COVID-19 hotline, which is 0800 02 9999, 0800 02 9999. A dedicated call center for the EVDS is being finalized, and that number will be announced and displayed on the EVDS portal system when you register. The details you provide us will also be used to communicate essential information on the vaccination program when necessary through this application. At the vaccination service point, the vaccination details of individuals will be recorded digitally, and individuals will be provided with a proof of vaccination card and will receive a confirmation SMS on their phone. Let me reassure South Africans that we do have a plan to ensure that everyone is registered, and we want as many people as possible to be registered before going to be vaccinated. This will save a lot of time and will also help us to allocate vaccinations to respective areas appropriately. We do understand that not everyone in this country has a smartphone or has access to internet. And for this reason, we'll be using the smartphones and petrol cards that have been donated to us by various companies and philanthropic organizations to send our teams to help our vulnerable citizens who do not have access to digital technology. These include the elderly, the homeless, and those who live in deep rural areas that will have difficulty to reach. Whilst we ensure that these team members are easy to identify, and that we can verify that they are indeed accredited, our accredited outreach teams, you need to also make sure that we'll make sure that you've got a way that you can verify them. We'll also recall that we had a successful community screening and testing campaign at the beginning of the pandemic, and we have indeed used the lessons learned from that initiative to devise our outreach program. Our team members will also be trained to be able to educate and raise awareness on the vaccination in the community. We're also proud that there will be a WhatsApp service added shortly that will allow people to register on WhatsApp. We'll announce that when that service is ready. If you are unable to register by these methods, you may simply go to the nearest vaccination center and we'll register you on the spot. That means when those vaccination centers are announced, then you will go there and just show up even if you were not able to register, so that you can be registered on the spot. So it doesn't mean that if you could not register, you can't then be vaccinated. And if you are not ready for vaccination, that is not your turn yet, we'll register you, but we may ask you to return for your vaccination. This is only because we are most at risk at getting sick or dying of COVID-19. So please bring your ID and your medical aid card, if you have any, to speed up the process. Finally, we want to urge those who are technologically savvy to assist our citizens to register. And please help your mother, your father, your grandmother, and your grandfather, or your friend who is 60 years or older to register so that they can get vaccinated. We can all guide each other and look after each other to get through this unprecedented crisis. For now, we will then be allowing the demonstration to take place. But I just want to indicate as well that, in the next few weeks, I think within the next 2 weeks, we will then be trying to get the portal to be open in different languages so that people can actually follow in their own languages. It's not ready yet, but in another 2 weeks, we hope that we will have concluded that aspect. And this portal, once we have demonstrated now, we request you to start logging in from 4 o'clock in the afternoon today, not before then. We just want to make sure that everybody understands how it is working, and then we can start preparing for it. But in the afternoon, we'll start registering. Let me then again assure all of us that we have said that on phase 2, which starts in May and goes up to October, we're focusing on people with who are vulnerable. So those are the senior citizens over 60 years and above, and those who are in the congregate settings, those who are vulnerable as frontline workers and so on. But even with them, we'd like to start with those who are above 40 so that we are able to deal with those who have got a real challenge, that if there is any infection, they have got a higher chance of getting more severe illness and more chances of getting hospitalized and even dying. So we will then be dealing with those with comorbidities in that regard. But in our studies, we've actually noticed that why it's important to deal with those who are with comorbidities. The bulk of the comorbidities that have been associated with high infection and more severe infection and hospitalization and getting to the ICU have been a lot more those who are above the age of 60 and followed by those who are above the age of 40. There's a lot of comorbidities in those ages, but at the same time, age has been a major factor, which is actually making it easy for us to just target those groups so that by the time we get to the end of the 6 months, we've covered most of those who are vulnerable, which is what this particular phase is all about. So we just need that we cooperate so that even if there are teething problems, we are able to make sure that everyone ultimately gets covered. We have focused to ensure that there will be enough vaccines to cover the numbers of people that we have targeted in this particular category. So because all of us are going to be ultimately getting vaccinated when our turn comes, I think it's important for us to just give each other the chance so that it's easy to schedule the vaccinations and allow everyone to come in at the time when they are due. Makes it easier, it makes it quicker. It also helps us to avoid the vaccination centers who, whilst it's important for all of us to be vaccinated, but can actually wait until those who are more vulnerable are cleared. And that's really the request we're having. And this is going to be happening both for public and private sector. We have said as well that our vaccines are going to be coming bought by government. They will be distributed to the public and the private sector. So even the industries who have made arrangements that they will be able to vaccinate people in their settings, and that will be based on the arrangement that we will be making to procure the vaccines from government to those private health settings. So all of us are going to be working. You will also notice when they demonstrate that you are not expected when you get to the vaccine site to pay any money. Your medical aid will cover it if you've got one. The government will pay for you if you don't have. And in this case, there should be no co-payments, no levies. Everyone must get access to the vaccine. That's why it's important to allow us to schedule the citizens in the way we think is the best way to reach equity for all. So no one actually will be left behind. We'll make sure that people are vaccinated as necessary. So at this point, therefore, we just want to say to the fellow South Africans that there is a system that we will utilize. That system will be open from 4 o'clock this afternoon just for registration. Then we will then be announcing to say these sites now are available. As we have indicated, there is the issue of the Johnson & Johnson vaccine. It's just a matter of a temporary halting that we have looked at. But we will be announcing as to when we resume for the health workers. And after that, we will continue when the rest of the vaccines arrive for the rest of the population. We really would like to get to plead for all cooperation to fellow South Africans, and all of us are going to have vaccines, those who wish to get vaccines, those who need to get vaccines, and we will make sure that we all have the vaccines as soon as it's possible. And of course, we have indicated all these phases so that we can make it easy to target those who are more vulnerable. It's important for us to vaccinate as many people before we get any kind of resurgence so that more people are protected. At this point, therefore, I would like to leave to the team, and Dr. Lwazi should help us to get the team to start the demonstration. And of course, at some point, I think Deputy Minister will also have to come in to make the final comments as we close the session. Thank you very much for your attention. Over to you, Dr. Manzi.
Thank you very much, Minister. Minister, I just want to read you a comment in the chat. Somebody has said, fantastic, registration portal is easy, just registered my husband and me in a matter of minutes. Thank you. So that's great feedback, and thank you very much to that person who typed that in the chat group. Minister, next on the program is the Deputy Minister, and so we will ask Deputy Minister to come through, and then thereafter we'll do the demo. Deputy Minister, Dr. Patla, over to you.
Thank you very much, Dr. Lwazi. My greetings to all our distinguished guests, our DG Business for South Africa, and all other guests. I'm indeed very pleased this morning in joining Minister Mkhize in the launch of this Electronic Vaccination Data System registration for South Africans over the age of 60. I wish to thank all South Africans for their support and cooperation with the government in the battle against this invisible enemy, COVID-19, over the last 13 months, since the first case was discovered, was confirmed in South Africa on the 5th of March last year. We know that it has been a very difficult time for many South Africans, if not all of us, battling with the virus at home, in hospitals, including in ICUs. Regrettably, many of our compatriots lost their lives, and even as we launch this registration system, many South Africans are still battling and fighting for their lives at home, in hospital, including in ICU. But despite the hardships, we appreciate the fact that if we did not work together, the casualties would have been much higher. We thank all South Africans for your sacrifices. We especially thank our health workers of all the categories of our health workers who have been in the front line to save lives. And at times, some of our health workers, this has been at the cost of their own lives. We thank the scientists in South Africa and all over the world who put a lot of energy and effort in finding vaccines, which are our last hope to overcome this invisible enemy. We thank South Africans for your patience during all our ups and downs with the rollout of the initial rollout of the Sisonke vaccine. As a responsible government, we have been very clear that we were not going to cut corners. We have come under criticism sometimes for not proceeding with vaccines whenever there were some doubts. But we believe that at all times we needed to act with certainty about the efficiency and the safety of the vaccines as we administer them. And as Minister Mkhize has indicated, even today, as we launch this registration system, we have suspended the J&J vaccine administration, but we hope this is not going to be for a long time. We hope to be back on track sooner rather than later. This morning, I'm joining Minister Mkhize in calling on all our over 60 citizens to register for vaccination. Vaccination is what we hope will bring us closer to normal social and economic activity, even if we know that that normality will indeed not be the old normality, but the new normal. We know that this is still going to be a long journey during which we must keep the tried and tested safety measures. We know those safety measures, which are physical or social distancing, avoiding crowds, washing our hands and sanitizing, staying outdoors whenever possible, and keeping in good ventilated indoors surroundings, wearing our masks whenever we leave home. We know that this registration technology is not going to be easy for every citizen, especially for the over 60. But as Minister Mkhize has indicated, there will be arrangements for those who will struggle with access to self-registration can be assisted. So I want to again say we encourage all our over 60 citizens to register for vaccination, because it is our belief that vaccines can save serious illness and also can save us from death from the COVID-19 infection. I thank you.
Thank you very much, Deputy Minister, for those remarks. We really appreciate. And now, without much further ado, I'm going to invite Ms. Melanie Womerans to then give us the live demo. Melanie, floor is yours.
Good morning. Can I have permission to share, please?
Yes, thank you. Wayne, if you could just allow Ms. Womerans to share her screen so that she may do her presentation.
Can you try share now?
Okay. Is my screen visible?
Yes, thank you very much. We can hear you and your screen is visible. Thank you.
Thank you very much. Good morning, Minister, Deputy Minister, Mr. Kingston, the Director General, colleagues, all the listeners and viewers. We as a team are excited to share with you and to just give you a demonstration of the official South African COVID-19 vaccination program, the registration portal. Just before I go into the demonstration, I would just like to make a few remarks to say that through this system, we really are only collecting minimum information from individuals. And the reason why we're collecting this information is to make sure that the vaccination process at the vaccination site can be as smoothly as possible. And we don't have an administrative bottleneck where people have to fill in a number of forms and being delayed. We also would like to make sure that you could get your vaccination at the closest place to where you live or either to where you work. With this, we are committing, and it is on this portal in the terms and conditions, that all the information that we are collecting from anybody will be in a secure place. We're also committing that data will not be shared with anybody, and that we will conform to all the legislation with regards to the protection of personal information. You're welcome to read the terms and conditions. In there, we tell you about the security, why we need your information, and what we will be using the information. And there's also a section in terms of what is your rights in terms of sharing information, and if we transgress or not providing your information or keeping your information in a secure space. The URL for the official South African COVID-19 vaccination program registration portal remains vaccine.enroll.health.gov.za. This portal, this is the landing page that's in front of you. If you go onto the URL, and it will indicate to you that vaccination is voluntary, you have a choice. Although we would like to have as many as possible of our citizens to get vaccinated. And it also indicates that everyone who registers will be offered the vaccination, and that's a commitment. We will start with people 60 years and older, and we will move down the age groups as quickly as we can. When it's your turn, you will receive an SMS with the date, the time, and the place of your vaccination. The first question that you need to answer is, are you a healthcare worker? And the reason why we're saying that is, and there was a question on the chat around healthcare workers, if you as a healthcare worker have registered on the self-registration portal when it was only open for healthcare workers, you do not have to re-register again. We, however, would like to get healthcare workers that hasn't registered before to continue to register so that we can vaccinate them during the period up to the 17th of May. So the first question then is, are you a healthcare worker? Just for the demonstration purposes, going to say yes. If I'm a healthcare worker, and then you will see that I can say no, because we don't want only healthcare workers above the age of 60 to register. We want all healthcare workers to register. And if I then say register vaccine, it says, if you are a healthcare worker, use the registration site for healthcare workers. And you can just link on this button here to say, take me to the healthcare registration, and you will automatically be taken there, and your information will become part of the information of the database of healthcare workers. So if I can focus on the population 60 and over, I'm going to say I'm not a healthcare worker, and I will indicate that if I say no here and I say register for vaccine, it will give a note to say, please note that the registration for vaccination is currently only open for those that are 60 years and older, and those under 60 years of age will be invited to register in a future date. And we will communicate as the age groups are opening, we will communicate extensively so that everybody can be aware when it's their turn to register. For the purposes of the demonstration, I'm going to say yes, I am above the age of 60 years, and I'll say register for vaccination. The first step is then to provide us with a form of identification. So it's either your South African ID number, or if you are a person with that is in the country that is not a South African citizen or a permanent resident, you could use your apologies. You could use your foreign passport, and then we also made provision for those in the country that can use their asylum seeker and refugee number for being able to have an identity number. Okay, so for these purposes, I'm going to use ID number. So the first that's expected from you is just to put in your 13-digit ID number. I'm just going to demonstrate so that if you are below the age of some kind of a way, it came through that you didn't see the answer or the pop-up on the slide, and you are getting to this page, and then you are typing in an ID number which you are below the age of 60. Then if I say confirm and I say next step, then it will say, please note that registration for vaccination is currently only open for 60 years. So you'll get the same message. So for now, let me put in an authentic ID number. I'm just going to type in the ID number. Okay, there was quite a number of inputs that we did while we were consulting to say what happened if you have a finger slip, but it will immediately then, that's why we included that you need to confirm your ID number, and you will just need to retype it in, and it will make sure that both the ID numbers that you type in is correct or is the same, and so that we can make sure that if there was a finger slip somewhere and you did by accident type the wrong number, that we actually get your correct ID number. Okay, passport number is optional. The system will automatically create your date of birth, and then you would indicate your name and surname. And then you can select the gender and confirm that your information is correct and go to the next step. So we made this specific step separate from the previous step because it's very important that we get the correct mobile number or a mobile number of a person with whom we can communicate around the vaccination program, as Minister have mentioned. This is not only a registration platform, but it also allows us to communicate via SMSs. For an example, we can tell you to which vaccination site to go and what the time is that you need to be at the vaccination site. But we can provide you also with information around the vaccination program if we have got a mobile number that we can communicate with. So we ask everybody that registers that they make sure that they provide us with the correct mobile number. If you don't have a mobile number yourself, you can use a friend or a family member's mobile number that you trust to provide you with information. In this case, it also, just to allow us to make sure that we type everything in correctly, we asked this to be confirmed for a second time. And then your email address is optional. You can provide it to us if you have an email address and you feel comfortable to share it with us. Then it's the next step. So this is the step where we would want to get information. And the reason why this information is important is to be able to inform you about your closest vaccination site, and also at the time of the date when you should go for your vaccination at that vaccination site. The first is to select the province. For the purposes of this demonstration, I will select Mpumalanga, and I'm going to select the Albert Lutuli municipality, which is in the Garsibandi district, close to the Swaziland border. And then I will select I can select a town or a suburb or a town or a city, or and these are all the places that is in Albert Lutuli municipality. So for the purposes of this, I'm going to select Eerstehoek, and then we went through a lot of effort to try and get as many as to close to possible to where people are staying. And there you can then select an area, or you can select a suburb, so that we can get details of where a person would be, in which area a person would be staying. For the purposes of this demonstration, I will select Deepdale. Deepdale is in Albert Lutuli, in Eerstehoek. It's in Mpumalanga province, in the Albert Lutuli municipality, in the Eerstehoek town, and it is an area, is Deepdale, close to the Swaziland border. Then you can also type in your residential address. This is optional. We didn't make it compulsory because we know that there are sometimes quite a number of challenges with an exact residential address. Once you've selected all of this, you go to next step. The step 5 of this registration system is now just to get a little bit of information on what would be your appointment preference, so that we can accommodate you as far as possible. So first of all, the question is, do you want to get vaccinated at the vaccination site close to where you live? If you would indicate yes, it will ask you the 2 questions. The one is, would you be preferred to be vaccinated on a weekday or a weekend? And then you would select one of these. It also will ask you, would you prefer to be vaccinated in the morning or in the afternoon? And then you would select one of these. I just would like to go back and then also indicate to you the no. So in a situation where you are living in, for an example, you are living, your residential address is maybe in Eerstehoek, but you are actually working in, for an example, in Barberton. Let's just use that as an example. and you would like to be vaccinated, for an example, to the place closest to where you work, then for this answer, do you want to get vaccinated at a vaccination site close to where you live, you would indicate no. And then you would select the place where you would like to be vaccinated closer. And I'll just use the same example, and then we'll go to... Sorry, I just need to find it quickly. And then you would go to Mjindi municipality, and you would select the town. Let's say we're going to select Barberton, and then in Barberton you can select the areas in Barberton as it is indicated here. Let's say Barberton Extension 5. And then you can indicate, I would like to be vaccinated on a weekday, and I would like to be vaccinated in the afternoon, and then indicate the next step. The next one, and that is step 6, so we're almost completed, is around the medical aid details. The information that's on this page says, please provide your medical aid details. It's important to note that your medical aid will pay the government directly for this vaccine. And also just reassuring everybody to say that this will not influence your day-to-day savings, your day-to-day benefits, your savings, or any other benefits of your medical aid. And also, you will not be required to pay for this vaccine, and also will not have to make any co-payment or levy at the vaccination site. The question is, do you belong to a medical aid? And if you click yes, then the list of medical aids that we have is registered on this list is what we have received from the Council for Medical Schemes. And then you can select any of the medical aids. I'll just select Bonitas. I'm going to put in a fake number for demonstrative purposes, and then it's next step. So here you'll see there's a summary of the information that's provided, your ID number, your name, your ID number, and your mobile number. We are asking that you just confirm that the information provided is your personal information and that it is correct. And then you can click the button. And then at the bottom here, you can go to it. This is the terms and conditions that I referred to when I started, and you will be able to read everything about the EVDS. The National Department of Health is the responsible party for processing any of this data, what we will do with the data, how does the EVDS work. We will not process any data if you haven't given consent. The issue of data transfer will only happen through required legislative provisions, and then the security measures that we have put in, and what is your right as the users. If you agree with this, then you would click the button and say submit registration. Then there's an information page to indicate that you will receive an SMS within the next 24 hours on the mobile number you provided, confirming your successful registration for vaccination. And closer to the time for your vaccination, you will receive another SMS with the date, the time, and the place for your vaccination. And if you have entered your medical aid details, could you please bring proof of your medical aid to the vaccination site? Thank you. These are the key components and of the official COVID-19 vaccination program registration portal. Just to say that anybody that attempts to register before 4 o'clock this afternoon, unfortunately, you will have to register after 4 o'clock. It's still a test version, and it allows us to do this live demonstration to you. So we really would like to ask everybody just to be a little bit more patient until 4 o'clock this afternoon, when it will be open, and then you can register. But thank you for the feedback that we have received. It is good to get positive feedback. And then lastly, Minister, Deputy Minister, DG, and everybody, I would like just to appreciate the team behind the scene that has worked tirelessly to put this system together so that we can launch it today. Thank you very much.
Thank you so much, Milani. We're going to ask you to just unshare your screen so that we may, thank you, so that in the meantime, thank you so much. It's wonderful to see that it's so easy to register. Just to reiterate again, I have also gotten many messages asking, well, it seems like I've been able to register. Please register after 4 o'clock. And now it's my great pleasure to invite Mr. Marston Kingston from Business for SA, representing business. As the Minister did say, we have all worked together to ensure that we are able to deliver the system. Martin, I see you're ready. Thank you very much. The floor is yours.
Thank you very much, Dr. Manzi, and good morning, Minister, colleagues at the National Department of Health, and everyone watching and listening. We recognize that we're all working in support of a comprehensive and equitable vaccination rollout to be implemented as quickly and as practically as possible. COVID-19 is a national challenge, not simply a challenge to government or business or even individuals. However, it continues to have a devastating effect on us individually and collectively. While government is leading the vaccination program, business, labor, and civil society have all mobilized in support of the national program. Coordinating our efforts will maximize the efficiency of the rollout. We welcome the launch of the EVDS registration process today for phase 2, and we also welcome the focus on the over 60s who are most at risk. This is significant progress. We fully understand and endorse the need to start with the over 60s and those with multiple comorbidities. They are much more likely to be admitted to hospital and indeed potentially to die. We must seek to vaccinate this group as quickly as possible and ahead of the third wave and the onset of winter. We have been working in support of our counterparts within government to help develop the system, and I would like to take this opportunity to acknowledge Melani's leadership and her team's professionalism and commitment. But we know that much remains to be done to build our technical and administrative capacity to scale up so that we can register and then vaccinate hundreds of thousands of South Africans each and every day. In January 2021, with the resurgence of COVID-19 infections and facing the unprecedented challenge of vaccinating the nation, Business for South Africa was reshaped with a singular focus of supporting the national under the leadership of the national government and specifically the National Department of Health. As Business for South Africa, we have mobilized businesses' capabilities and resources to increase our nation's vaccination capacity. Together, we are stronger. We will move faster, further, and more fairly. If we move together as a nation, we will achieve our goal of vaccinating as many people as possible, with the goal of vaccinating the majority, if not all, of the adult population by the first quarter of next year, if not before. We asked for and we've received the services of well over 100 very senior volunteers from our leading healthcare and professional services companies who are working to assist the national effort. And our volunteers, who are both individuals and companies, are not paid, nor do their companies receive recognition for their contributions. We hold no budget and we procure no services. We're inclusive and we work in a spirit of social solidarity with our partners in government and civil society. Business for South Africa has reorganized itself to mirror the work streams in the National Department of Health so that business support aligns as seamlessly as possible with our government counterparts and provides integrated support in the design, the development and implementation of the vaccine rollout program, and particularly with regard to the administration of the vaccine. In that context, B4SA has created a specific operationalization workstream that will build the private sector capacity to vaccinate approximately 160,000 people every day across corporate and independent pharmacies, across employer occupational health sites, and large-scale sites developed by medical schemes, as well as GPs, private hospitals, and mass vaccination sites. All of this is being done in close cooperation with and under the leadership of the Department of Health to maximize the efficiency of. Working with government, private sector companies will vaccinate both public and private patients. No citizen will be denied a vaccine. We need to work with all stakeholders in communicating the need for all adults to be vaccinated as quickly as possible. And we thank all stakeholders from government, business, civil society and labor for their assistance. The Solidarity Fund is a critically important partner in this process, and Dr. Manzi has noted in the chat room the National Communication Partnership where all of these stakeholders are involved. We all need to cooperate and abide by the rules of the systems that are being created, and we call on all eligible South Africans to register on the EVDS system from 4 o'clock this afternoon. We know that we are just at the beginning of a massive national effort. Not everything will be smooth sailing as we are building this capacity as we go, but we are committed to addressing any issues quickly and collaboratively. Everyone needs to play their part. We are confident that we can defeat this once-in-a-century health crisis and reach our national goal of 40 million vaccinations by the first quarter of next year. By harnessing all the energy, expertise, and commitment in South Africa, we will save lives and we will rebuild livelihoods. Thank you very much.
Siyabonga kakhulu Baba Kingston, impela kuyathokozisa ukubona ukuthi osomabhizinisi bayasebenzisana nohulumeni wethu. Ngizocela ukuthi u-Deputy Minister uBaphahla abuye asithulele umlayezo ngeSpedi. Deputy Minister. Deputy Minister.
Re a leboga sepediši wa modiro ka nako e ke rata go tsebisa badudi ka moka ba Afrika Borwa gore letšatši la lehono kgoro ya maphelo e buletše go ingwadiša ga badudi ba Afrika Borwa ba ba lego mengwaga e 60 go ya godimo gore ba ka ingwadiša lenanong la moento wa go thibela bolwetši jwa corona goba bjo bitšwago gape COVID-19. Re a tseba gore matšatšing a fetilego moento o buletšwe bašomedi ba maphelo. Ge e le ga lehono re buletše go ingwadiša ga badudi ka moka ba Afrika Borwa ba mengwaga e 60 go ya godimo. Letšatši le ke le legolo mo go rena moka re le ma-Afrika Borwa ka gore go ingwadiša mo go ra gore matšatši a tlago ka o ingwadišitše le tla hwetša molaetša o tla go tsebišang gore o ka ya mo kae mo ka go hwetša moento wa go thibela bolwetši jwa corona goba COVID-19. Bjale re dira boipiletšo gore go ingwadiša mo o ka kgona go ingwadiša o šomiša cell phone tše di bitšwang gore ke di-smartphone goba computer mo go nago le internet. Ge o se na le tšona tšeo ge go šitše go tsebišitšwe gore meento e tla be e direlwa mo kae kgauswi le wena o ka kgona go ya kgauswi le mo o dulang gona mo o ka ingwadišago gona mo o tla hwetšago thušo ya go tengwadiša gore o tle o hwetše molaetša wa gore letšatši la gago la go hwetša moento wa go thibela bolwetši jwa COVID-19 e tla ba le lefeng le gore o tla hwetša moento o mo kae. Re lakaletša badudi ba Afrika Borwa ka moka ba mengwaga e 60 go ya godimo gore e yang kgauswi mo le ka kgonang go tengwadiša le lena ba baswa e re bokoko a lena boragolo a lena bomagolo a lena bomalome ba ba lego mengwaga e 60 go ya godimo le ba thuše ka di-cell phone tše le nago le tšona di-smartphone tšeo le di-computer mo go nago le internet le bangwadišeng gore ba tle ba hwetša go ka hwetša molaetša gore ba ka ba hwetša moento mo kae. Re le lakaletša ka moka gore e yang re le tutuetša ka moka gore e yang mo le ka kgonang go ngwadiša goba ba baswa ba ka kgonang go le thuša ba le ngwadiše ka gore moento kona o tla re thusang gore re thibele gore ge re ka hwetša twatši e re se ke ra ba jwa kudu ra hwetša re le ka sepetlele ebile re tsene mo di-ICU ebile e tlo re thibela gore bolwetse jo bo seke bja fetša gore sepedišitše mo lefaseng. Re dira boipiletšo gore kutu a re eng re o tingwadiša re berekišeng di-cellphone di-computer tša rena ge re sena le tšona re eng kgausi mo re ka engwadišang gona. Ke a leboga. Thank you very much.
Siyabonga kakhulu Tawu. Sizocela ke uKhabazela ukuthi asivalele ngesizulu. Gcwabe.
Siyabonga kakhulu Dr. Manzi naku Tawu Deputy Minister nakubo bonke ababukela lolu hlelo emakhaya. Sibonga kakhulu bakwethu ukuthi sinazise namhlanje ukuthi sizovula uhlelo lokubhalisa lo computer lokuthi abantu abasifisa ukuthola imijovo yokugomela isifo se-COVID-19 sebengaqala ukubhalisa. Kodwa nje basasichazile uhlelo lokugomela luhlukene izigaba ezintathu. Isigaba sokuqala bekuyileso sibhekene nabasebenza ohlangothini lwezempilo ngoba ibona ababhekene phambili nalesifo se-COVID-19. Bese uhlelo lwesibili ozoqala manje ngoMeyi uhlelo oluzobhekana kakhulukazi nalabo abasezimweni ezisebenza nabantu abaningi lapho kulula ukuthi batheleleke khona ngesifo noma bathelela abanye abantu ngesifo. Labo-ke lapho sibala khona abantu abasebenza ezakhiweni zomphakathi labo abasebenzela umphakathi. Kodwa ikakhulukazi sibheke kulabo abanokuthakathaka okuzokwenza ukuthi kube lula ukuthi bathole lesi sifo. Lapho sibheke kubantu abaningi abasebekhulile abasukela eminyakeni eyishumi kuya phezulu nalabo abanezifo eziningi ezihambisana nokukhula, izifo zoshukela, izifo zenhliziyo nezinso kanjalo. Kodwa into esiyitholile lapho ukuthi uma sibuka abantu abakhahlazimezeka kakhulu ngalesifo uqala eminyakeni eyisithupha kuya phezulu, ibona abagula kakhulu, ibona abalala kakhulu esibhedlela, ibona futhi abashonayo. Ngakho sifisa ukuqala ngabo uma sinikeza le mijovo yokugoma. Bese kuthi-ke emva kwabo kuze abantu abanaminyaka ngaphezu kwama-40 esitholayo futhi banezifo kakhulu labo, kanti ibona futhi abalandela ngobuningi abagula kakhulu baphathwe yilezi zifo nalesifo se-COVID-19 kanye nokuthi balale ezibhedlela emagumbini abantu abagula kakhulu abagcina beshonile futhi. Abantu-ke abanezifo amahlala khona nezifo ezikhahlaza umzimba baningi kakhulu kuleyo minyaka. Ngakho-ke sizoqala ngalabo abasukela eminyakeni eyama-60 bese-ke uma siqeda bese sizama besiqala futhi kulabo abaneminyaka yama-40. Kodwa ngendlela esizokwenza ngayo-ke sifisa ukuthi wonke umuntu abhalise ungasebenzisa i-cellphone yakho noma i-smartphone noma usebenzisa ikhompyutha. Lokho kubhalisa kuyakulandela ukuthi ukuthi uzisho iminyaka yakho, uzisho ukuthi uhlala kuphi. Uyakwazi ukukhetha ukuthi uma uzogonywa ukugoma kwakho ufisa kwenzeke kuyiphi indawo, mhlawumbe usihlala kwenye indawo kodwa usebenza kwenye indawo, ufuna uhlukanise lapho kwenzela ukuthi abahlelayo bezokwazi ukunikeza indawo eseduze kakhulu kwalapho la uzobe ukhona. Bese uyachaza futhi noma ufisa ukuthi uma uyothola umjovo wokugoma uthole emini noma uthole ntambama noma uthole phakathi nensuku noma uthole ngempelasonto. Konke lokho kuyavela uma ngabe uyilandela kahle lolu hlelo. Into esingayisho ukuthi okwamanje lolu hlelo usabhaliswe ngesilungu kodwa kula masonto amabili ezayo sizama ukuvula zonke izilimi kwenzela ukuthi ungaxakeki uma ufika kulolu hlangothi lokuzibhalisela. Kodwa siyacela ukuthi abantu abaningi babhalise noma babhalise izihlobo zabo noma omakhelwane, ogogo nomkhulu, obaba nomalume, kanjalo abantu abangase badinga ukusizwa ngoba uma wenza kanjalo sizokwazi ukusheshe sifike ekutheni sibahlelele ukuthi sazi ukuthi endaweni ethile bangaka abantu abazodinga ukugonywa kwenzela nemijovo siyisondeze ibe miningi yanele labo bantu abazobe belapho. Kubalulekile futhi ukuthi sichaze ukuthi abantu nama-medical aid kufanele balibhale inamba yabo, bazisho ikhadi labo baliphathe bafake ukuthi une-medical aid. Excuse me. Phezu kwalokho sobe sibhalisa nge-ID yomuntu bese-ke umuntu kubonakala ukuthi iminyaka yakhe yamvumela ukuthi angene kwamanje. So lokhu sivula kancane kancane senzela ukuthi abantu babhalise ngenhlelo ezokwenza kube lula ukuyobagoma. Uma ngabe ukuthi awuyena waseNingizimu Afrika une-passport kodwa ulapho ngokusemthethweni kuzobalula futhi ukuthi ubhalise ngoba kuzovela isikhala sokuthi ugcwalisela ngakubo. Laba abasebenza kohlangothini lwezempilo bangaqhubeka babhalise lapho sasibavulele khona, kodwa uma ungene kuleli khasi leli wazithola ukulona njengoba sibhalisa kwamanje, lizokubuza ukuthi umsebenzi wezempilo noma uyena. Uma uyena likubuyisela lapho abezempilo babhaliswa ngakhona ngoba sisazoqhubeka nabo nokubagoma noma ngabe kwalesikhashana besamile kodwa siyaqhubeka. Ngakho-ke kuzohlukana kanjalo. Kubalulekile futhi ukucacisa ukuthi uma usuya kogoma sifisa ukuthi ugome eduze kwalapho la ungakhona akwazi ukufinyelela khona. Phezu kwaloko awufanele ube nomuntu ozokukhokhisa ngaphandle kokuthi uma une-medical aid yona eyokhokha ekhokhele ukugoma. Kodwa uma ufika awufanele ube nemali ozokhipha ekhukhwini uyogcwalisela kukhona okunye ufanele ukukhokhe. Kufanele umuntu athole umjovo ngaphandle kokuthi akhokhe. Abantu-ke bazogonywa bonke ngobuningi babo baseNingizimu Afrika ngokwesidingo sokuthi banikezwe uhlelo lokugoma. Akuzuya ngokuthi uyasebenza usebenza unemali awunamali, kuzoya ngokuthi ukuleso sigaba esifuna sisheshe okwamanje. Sithe ukugoma-ke lolu sigaba sesibili siqala ngoMeyi soze sophela ngo-October. Ngakho-ke sobe siqala ngamaqembu senzele ukuthi kube lula usheshe sifinyelele kubantu. Mase sicela laba abanganeminyaka ngaphezu kwama-60 sicela bona bese kuthi emva kwalokho mhlawumbe abanye sobe sibagome endaweni la besebenza khona. Kulabo abasemsebenzini sobe siqala ema-40 siya phezulu ngoba iningi labantu nama-60 sobe ngasekho sobethatha impesheni. Ngakho-ke konke lokho kulekelela ukuthi abantu abasibona befanele ukuthi bathole ukugoma masishane kulesigaba sesibili mabakuthole ukugoma. Kubalulekile usibambisane ukwenzela ukuthi sisheshe sidlulise lapho esibonayo ukuthi mangabe kuthiwa kunesiwombe esiqhamukayo sesibili sale mkhuhlane sizobahlupha kakhulukazi laba sebekhulile nalabo abanezifo. Ngaleyo ndlela-ke sifisa ukuthi sibambisane. Iningi lethu abanye abangenazi ingxaki kakhulu siyogoma ngokuqhubeka kwesikhathi ngoba imigoma ikhona mningi. Sesiyibalile ukuthi izoba ngaphezu kwabantu izigidi ezama-40 million. So baningi kakhulu abantu abazoyithola imigomo. So singampintshani singaphushani futhi umuntu eze ngoba sekubiziwe. Uma ngabe ubhalisile uzobuyisela umyalezo osho usubhalisile linda sokubiza mase sekufanele. Okwesibili uzosho futhi ukuthi uma usugomile uzokutshela ukuthi asugomile, ngakho-ke uyohlala kunobufakazi obukhona ucingweni lakho ukuthi wawugomile. Ngaleyo ndlela siyafisa ukugqugquzela kakhulu ukuthi sibambisane kulolu hlelo. La nje basikhuluma ukuthi kunemjovo esithe kuyimisa kancane bekusekucwaninga nje ukuthi sibone ukuthi ikhona into ephazamisayo ngakutheni basiqhubeke, kodwa asithembi ukuthi into yozoba unomphela. Sicabanga ukuthi kulezi nsuku ezizayo kuzobe kuvulwe kuqhutshekwe ngoba phela yonke imjovo iba nazo iy'ntwana lapha nalapha yayihlupha ngazo, kodwa siyithathe njengento esiyenza ukuthi sekufanele siyesabe le mjovo yokugoma ukuthi kunenkinga kakhulu. Simemezele futhi ukuthi imjovo ezoba khona kwamanje sithole ka-Johnson & Johnson, sithole neyaka-Pfizer. Kakhulukazi-ke endaweni ezisemakhaya sizama ukuthi sisondezele ka-Johnson & Johnson ezokwenza ukuthi umuntu ajove kanye ngadinga ukuthi azabuye kwesibili. Bese kuthi endaweni eziseduze kwasemadolobheni ukuze singaphelelwa imjovo sonikeza leyo ezothi umuntu ajove kodwa kube lula ukuthi asheshe abuye ngoba sazi ukuthi isikhungo sakhe asizomxaka uma ngabe udinga abuye azojova kwesibili. Ngaleyo ndlela-ke siyafisa sibambisane bakwethu ngoba uhlelo lokugoma seliseduze kakhulu ukuthi ufike ngakunina okwanamhlanje besonazisa nje ukuthi kusukela ngo-4 ntambama ibe niqala nibhalisa kwenzela ukuthi abakwazi ukungena babe bengena. Kodwa uma ungawazanga ukubhalisa kodwa usuzwa ukuthi kunesikhungo esivuliwe kodwa kule minyaka esiyishoyo udinga ukuthi uvele uthathe ipasi lakho ushone khona uyosho ukuthi hayi angikwazanga ukuzibhalisa mina kodwa ngisuke sekuyajova umgomo usufikile ngicela ningibhalise. Bazokubhalisa bakungenise bakujova. Kodwa uma usheshe wafika wafuna ukuzobhalisa kanti isikhala sakho asikakafiki njengoba mhlawumbe umncane ngesimo okusona uyafisa ukujova, uzocelwa ukuthi uzobhaliswa ulinde mase kuvulelwe ontanga bakho ukuthi bakwazi ukuthi babhalise bakwazi ukuzogoma. Kusho ukuthi singaphushani singacineleli ngenkani silekelelane nje ukuthi kusheshe kulungiswe labe sazi ukuthi uma kuthiwa kunesiwombe esiqhamukayo siyazi ukuthi baphephile kakhulukazi abadala nalabo abanezifo nalabo abaphambi kwabantu, kwenzela ukuthi singabi nenkinga ukuthi uma sibuye isiwombe sisilandelayo sisihluphe kakhulu. Kodwa siyathemba ukuthi ngokubambisana njengoba njengamanje kusafanele siqhubeke nokufaka ama-mask izifonyo, kusafanele sisebenzise ukugezwa kwezandla nokufaka ama-sanitizer, kusafanele siqinisekise futhi ukuthi abantu bayaqaqana lapho besebenza khona nokuthi uma sihleli endaweni eshaya umoya singampintshani kakhulu. Konke lokho kuzosinceda ukuthi lesi sifo singasheshi sisixine kube imjovo ibiyangena Ofika isikhathi la sokuthi mase siyabheka sithola ukuthi abantu abaningi sebegomiwe abasenayo inkinga kodwa futhi nesifo sisesithe kuhle siyomemezela mase sibona kufanele ukuthi hayi sesingayeki uyifona okwamanje sezidinga siqhubeke nje kodwa sense. Siyabonga kakhulu ukulalela, siyabonga kakhulu ukubekezela kwenu, siyabonga kakhulu.
Siyabonga kakhulu Khabazela-ke mangiphinde lapha abantu abangakwazi babhalise khona. It's vaccine.unroll.health.gov.za, vaccine.unroll.health.gov.za. Thank you very much to the viewers at home, to those who joined us on the Zoom platform, to the broadcasters who have partnered with us throughout this journey. Thank you all and have a very good day and a good weekend.